to be useful, we should collect the data and ask those questions. But you do need more sophisticated statistical analysis to answer the main question we were asked, which is, could you have been caught earlier? Could you have blown the whistle? And using the data collected by this investigative doctor, we could plot the excess mortality, the observed number of deaths, minus the expected number of deaths, known as the excess. Just as in COVID, we're always calculating excess deaths, the observed minus the expected. And those increase for women and for men right over 20 years. So if somebody had been looking at the data, when should they have blown the whistle? When should they have said, whoa, this is strange? And this is not an easy statistical issue for two reasons. First of all, and they're both to do with what we would call multiple testing. First, that if you keep on looking at any set of data and keep on testing for different, you'll always find something strange eventually. And there's some good theory to say you'll always, at some point, even if someone is fine, at some point something strange, it'll look strange, if you keep on testing. And the second thing is that there are 26,000 general practitioners in the country, and we can't all accuse them of murdering their patients if it looks a bit strange. So we have to allow for the multiple looks at the data and the large number of GPs. And fortunately, there are techniques to do that were developed in the Second World War, and we adapted, sequential testing, and you produce this statistic, and you put very stringent criteria, alpha and beta. That means a 1 in 100,000 chance of making a mistake, either a false positive or a false negative mistake. So really stringent to allow for the fact there are so many doctors. And even if you did all of that, you could, after 40 deaths, you could have confidently said, this is strange, he is strange, someone should look at this. But nobody did, because nobody was looking at the data. So again, it's an example of, and these techniques now have been being used in all sorts of areas for early detection of signals, but it's an example that it's not just the analysis, you need to look at the data. Somebody has to collect that data and look at it. What was interesting is that after that, a group of my colleagues, Nikki Best and Claire Marshall and others, applied these techniques to 1,000 other doctors to find out what would happen. And when they did that, here is Shipman, but look, there's 6 worse than Shipman. Have we found 6 more, even worse mass murderers? No. These were really good doctors. They worked in communities with a lot of old people, on the coast in Eastbourne and places like that, and they were really good doctors that that provided the care so that patients could die at home rather than hospital, and so they were signing large numbers of death certificates. So these were the most caring doctors in the country, and yet they triggered before Shipman. So which just shows, this is, for me, is a brilliant example of correlation and not causation. Just because somebody is extreme, you cannot conclude this is bad. So all the statistics can do is to say a human should look at this in more detail. It cannot conclude causation. So that's a warning about statistics. There were doctors with more deaths. These were the best sort of doctors. Statistics can only detect outlying behavior. Correlation is not causation. So a very strong lesson about the power, but also the limits of statistical analysis. It cannot think for itself. We have to do the interpretation. It's our responsibility. So I think there's some big lessons. Okay, just to finish off, Challenges and opportunities. Well, misinformation is a huge challenge in the world, but particularly for statistics. There's so much misinformation which are based on statistical claims. So much of the misinformation are false claims based on statistics. How can we counter this? You know, it's difficult. I think you can do it at source by trying to maybe stop it, but certainly label it, which I see labels on Twitter. I get tweets now with labels on it. You can try to prevent the spread by at least having transparency about the recommendation algorithms on TikTok, and YouTube, and by calling out false claims, by identifying it. And that means better education of people, fact-checking organizations. So lots of people have responsibility. We can never stop it, but we can try. But what we need is, and I gave a talk on this today in the department, we need trustworthy communication. And we wrote an article in Nature trying to summarize what we meant by trustworthy communication. And those are the main things, that we should be trying to inform, not manipulate or persuade somebody. We should be genuine, trying to empower them by giving them information. We should be balanced, not a false balance, not equals 50-50, just be balanced, the positives and negatives. And we should be upfront about uncertainties, the quality of the evidence, and we should, what's known as pre-bump, really hit misinformation early, preferably before people have seen it. You warn people. Do you know there's people saying blah, blah, blah? You get in there fast on misinformation. So again, I apologize for people who are at my talk at lunchtime, but I'm going to use this example again because it was an example of where we worked to try to do this. And this was a very difficult time when the blood clots associated were linked to the AstraZeneca vaccine, which had been given to large numbers of people in the UK. And we got the data on the blood clots, and on the Monday, and on Wednesday, there was going to be a big public announcement about it. And we analysed the data, fitting Poisson regressions, and everything, it was lovely, great stuff, and showed that the vaccines were more harmful the younger you were, so it was age-related, and then also used a model for the benefits of the vaccine and prepared some graphics. And these were the graphics we prepared, which basically, the crucial thing is that vaccines, the benefits and harms of vaccines depend massively on how old you are. For an old person like me, the benefits on the left really outweigh the possible harms. But as you get younger, it gets closer and closer until under 30, well, really it's finely balanced. And so the Deputy Chief Medical Officer announced this, used our graphics live on BBC to a huge public audience, and then said, so we're not recommending the vaccine now for younger people. So, and we thought, wow, you know, how is this going to be received? And because he was so honest and trustworthy and talks about the benefits and harm, he didn't use words like safe and effective, because it's not completely safe, it's not completely effective. He didn't use these quick, easy phrases. He treated the public with respect and talked to them honestly, and it went down very well. And then everybody copied. Everybody copied this. Italian version there, with a European version there. Everybody copied this basic format afterwards. And so that was our success, I think, in trying to put into practice the ideas of being trustworthy in the communication. Okay, so finally, we've already had a mention of ChatGPT, which didn't write this talk, although I do use it in my work. I use it for coding, I use it for summarizing information. The large language models are already showing extraordinary skill at coding, and I don't know if you've seen the add-on to ChatGPT Plus that does automatic data analysis. You put in a spreadsheet and say, give me some cool graphs, and off it goes. Woof. It's wonderful. Well, it looks wonderful, but is it? No, is it? You know, these are really powerful tools. How trustworthy are the claims? Can I trust their analysis? Because ChatGPT says some strange things. It has these hallucinations. But I actually think there's a potential for benefit, because maybe, just as they built in to these systems that they will not be racist, they will not be violent, they managed to control what they say, perhaps they could build in good quality statistical analysis. Whoa, that would be good. That would be for our own benefit. I'm not sure if they will try to do that, but wouldn't it be great? In fact, also, maybe they could use to detect misinformation. My idea, I really think you should do this, because I spend a lot of time criticizing scientific papers and press releases, and I just want to be able to feed them into ChatGPT, and it'll tell me what's wrong to save me having to do it. So, conclusion, data literacy is the essential skill in modern life, both to do analyses and as consumers of analyses. And that's why to have such a strong department in this university is so important and so valuable for everyone. But it's important to everybody, you know, just as citizens. We have these roles. So I'm all three of these in a sense. You know, citizens need to be able to think about what they hear, what the claims are. They shouldn't just have to either accept or reject them. So many employees now require some level of statistical skills. Healthcare workers, media, journalists, analysts, civil servants, and politicians. We're trying